Hi, and welcome to Aesthetica Magazine, a TV series on the latest in aesthetic medicine and the latest in spa treatments. Today, we're fortunate to have Dr. Barry Resnik, a prominent dermatologist from Miami, who's taken time from his busy schedule to be with us. Welcome, Dr. Resnik.
Thank you. Good morning.
Thank you for being here with us today. Dr. Resnik is a cosmetic dermatologist. He does hair transplants, skin laser treatments, spider veins, face peels. You run the gamut. You have a very busy practice and cover a lot of cosmetic as well as regular dermatologic care. Is that correct?
Yeah, I like to say that we do adult cosmetic and pediatric.
Okay. And you are an assistant clinical professor of dermatology at the University of Miami School of Medicine. You've been past secretary, treasurer of the Florida Society of Dermatology and Dermatologic Surgery, and I understand you've been past president of the Miami Dermatologic Society.
I have.
And you trained, where did you train in dermatology?
I trained at the University of Miami at Jackson.
Oh, nice place. I went to medical school there. Today we're going to talk about Botox and silicone. These are treatments that dermatologists and other cosmetic practitioners use to deal with wrinkles. And Dr. Resnik, the first question I'm going to ask you is, what exactly is Botox? We're hearing a lot about it from Oprah to late-night TV. Tell us a little bit about it.
Botox is the trade name for botulinum toxin A. Botulinum toxin A, when injected into muscles, relaxes them in a temporary fashion. It was originally characterized by an ophthalmologist, and the ophthalmologist assistant, an ophthalmology resident, was married to a dermatologist, and when they injected it into the muscles around an eye to stop the eye from moving from muscle spasm, they found that the skin lines relaxed in the areas where the botulinum toxin was injected. And the rest is history.
So it sort of paralyzed the muscle?
It does so in a temporary manner. It's injected into the skin. It doesn't go into the body. It's very effective, lasts about 2 to 5 months.
And how safe is it?
Well, we all know that botulinum toxin is what causes botulism or food poisoning, but we're using micro amounts. We're using on the order of a unit, and when we talk about units, someone may get 60 units in a treatment, not nearly enough to even be picked up in the bloodstream after it's injected, and yet strong enough to paralyze the small muscles that we use in the face.
So your body will metabolize it, break it down, and so you need to be re-injected or retreated, if you will?
Right.
And how often should that be done?
Everybody's different. But what I typically say to patients is I say you should expect to do it 4 times in the first year, which translates to about a 3-month duration. It depends on the bulk of your muscles. When we talk about muscles, we think about chest muscles and arm muscles, biceps and triceps, but some people have very large muscles on their faces. They use them a lot. They frown and they raise their eyes, and that action constantly over time will degrade the Botox. And it's interesting. What happens is the molecule grabs over the receptor for the nervous impulse that makes a muscle move. And over time, that cap gets broken down by the constant bombardment of muscle and nerve impulses until it breaks away. So that's why people have a different duration of time.
And does the body ever develop any defenses against it, or an autoimmune response to keep it from working?
Certainly, if you get injected with massive amounts of Botox, or if you've had an episode of food poisoning as a child, you can have antibodies to it. This is about the only situation where you're going to have someone not respond to Botox treatment. It's not a common thing for us to test for antibodies to botulinum. And in common and regular, well-used manner, you're not going to have a problem with it.
And what can an individual expect from a cosmetic treatment? And we have some images that we can go to.
Right. Let's take a look at our first image. Here you have a young woman whose age I can't tell you because she'll kill me. But she's concerned about lines across her forehead, particularly in the region just below her hairline. When she raises her eyebrows or raises her forehead in surprise, she'll get these lines. Can we see the next image? Here we are. She's actively moving these muscles. You can see those lines being formed. She's had previous injections of Botox between the eyes. That's called the glabellar complex, and that is the area where most people see frowning areas. But people use different parts of their face in a different manner. She was very much concerned about these lines above, just under her hairline, and we'll see the third image. Here she is directly after we've injected the Botox. And you can see that she's got little blebs or bumps, and that comes from the saline solution that we use to mix the Botox protein in. The Botox protein comes as a dried powder. We mix it, inject it. These bumps will go away by the time she gets out to the car. Now we'll see the fourth image. And here she is desperately trying to raise those lines. You can see that she has complete immobility of the area where she was concerned. So that's basically what you can expect with a Botox treatment.
So that's in the forehead, and you can use that in other parts of the body?
It has been used in many parts of the body, and not just for cosmetic rejuvenation. We're going to be talking about injections into the neck, but it has been used injections around the lips, injections into the corners of the mouth to try to raise these areas up. It's also been used for spastic or contracting muscles in orthopedics, especially in pediatrics, where you have children with cerebral palsy, where they inject the Botox in bulk into muscle and it relaxes contractures. It's been used to help sweating in the palms, underarms, and soles in a condition called hyperhidrosis. It is a very versatile medicine.
And do you have any slides of the neck?
Yes, I'd like to show you that. Here we have an image. There's a band of muscle and fibrous tissue called the platysma, and when you grit your teeth and make a big smile, you'll feel that band bump up, and there are distinct bands of muscle. You can see on the right-hand side of this picture, there's this woman making a face to show me the muscle bands that we're going to inject, and what we've done is we've injected Botox into areas along those bands of muscle which we grasp between the tips of our fingers. We'll see the second picture. Here she is now after injection. This is about 3 weeks post-injection. You can see she's trying to make that grimace, that move to raise the platysmal bands, and you can see that they are now disappeared. What this does is gives us a modest neck lift. You can see that there's some change in the angle under the jaw. She's got a smoother appearance. She doesn't have those bands of muscle. And when you relax the bands of muscle on the neck, you get unopposed movement from the muscles in the face. And it basically pulls it up and gives them a little bit of a lift in a non-surgical manner. There's no incisions done,
Yeah.
no bleeding.
That's very nice. Now, will Botox tend to make fine wrinkles or even medium wrinkles disappear over time if you have a prolonged treatments with Botox over the years?
The biggest myth that we have to deal with on a daily basis is the fact that Botox will make lines disappear. It won't. What will happen is that over time, if you don't reinforce them, they will become less prominent. It's the same situation where you have a cast on your arm muscles tend to get smaller, they atrophy, and you take the cast off and you build it back up. If you keep that cast on indefinitely in the form of Botox, you will eventually have atrophy of the muscles of the face, and you will have a nice smooth appearance. You know, it's not going to make every line disappear because you will have referred movement. When you smile and you get a big smile, you get these cheeks moving, you'll see movement in areas that are frozen with the Botox. But when you put your fingers here, you won't feel the movement. It's like touching a set of curtains. You'll touch the curtains on one side. The curtain over here will sway gently from referred movement, but it's not going to reinforce the pleat.
Mm-hmm. How about facial expressions like, you know, surprise or joy or smiling? To what extent will Botox affect facial expressions?
I like to say that once you have Botox done, you're going to look calm when you're upset, calm when you're happy, calm when you're at rest. There are some practitioners out there, both dermatologists and non-dermatologists, who inject so much Botox in an effort to please a patient or to get a patient to meet their expectations that they have virtually no movement on their face. They can't smile. You know, one of the problems with injecting Botox in the lower level of the face is that you lose the ability to make a kiss, pucker up. You will have difficulty sipping soup, sipping coffee. One prominent dermatologist made the comment that he's happy to do it if they don't mind drooling for a couple of months.
So the higher up on the face, the better for Botox?
I think that the majority of physicians who use the Botox restrict themselves to the upper face. And when we're doing in the lower face, we are using a much lower dilution, so we have less active Botox in each drop, and we are using less Botox. You know, maybe a tenth of a cc in two areas to help relax these lines. It requires a touch.
Yeah, so buyer beware. You go to somebody who knows, who's done it.
Caveat emptor is the way to go.
Yes. So what else in your armamentarium for treating wrinkles, what else is, are you using or commonly used to treat wrinkles of the face?
Well, Botox is a relaxer. And the other form that we're looking at are fillers. And they break down into things like temporary fillers and permanent fillers. And temporary fillers can include Restylane and Perlane. They can include Radiance.
Are these synthetic or?
Restylane and Perlane are synthetic forms of a particular protein in the body. Radiance is a type of bone cement. We have collagen, both human-derived and bovine-derived, or from cow skin, which has been very popular. What we're going to talk about today is silicone, which is a natural...
Silicone?
Silicone is the generic term. It's actually something called polydimethylsiloxane. Much easier to say silicone.
Absolutely.
The brand name is Silicon. It is an FDA-approved material for the treatment of retinal detachment in ophthalmology, and we're using it as an off-label use.
And how safe is silicone?
Silicone is inert, doesn't support bacterial or viral growth, and when done in the fashion called microdroplet technique, it's about as safe as you can get. Of course, there are always side effects and complications that you have to consider. When we do consultations, I always talk about the risks, the benefits, and the alternatives of anything we do. The risks with silicone are bumpiness under the skin, granuloma formation where you get redness or even open sores, migration, which is something that some people are concerned about, is not something that happens when it's done in microdroplet form.
When done properly.
When done properly. You know, the body responds to silicone in the same manner that it might respond to a splinter. It sees it as something that shouldn't be there and wraps collagen and fibrous tissue around it. It's like seeding an oyster with a grain of sand. You're getting a pearl of collagen in each place where you're putting the silicone.
And where would you choose to use silicone in treating patients with wrinkles?
Most of the time we're talking about facial use. We're talking about lines between the nose and the mouth. They're called melolabial folds. You're talking about the marionette lines. It's not as appropriate, especially in the form that we're able to use, for areas on the sides of the eyes and under the eyes. It is too thick a material.